Hey everyone, Dr. Alex Ritza, downtown Toronto chiropractor, acupuncture provider, manual therapist, talking to you from the King West Club in downtown Toronto. Today what we're going to be talking about is ankle sprains and what I do to treat them. So a lot of patients that I see and a lot of people out there, it's one of the most common injuries in the planet, lateral ankle sprain. So those that play soccer, baseball, or any track sport, anytime you roll that ankle, usually you're sustaining an injury to that anterior talofibular ligament on the outside of the foot. One thing that a lot of people don't know about with these injuries as well is that the nerves that travel on the outside of the foot, the superficial and the deep fibular nerve, they're the ones that go to the fibularis group on the outside of the leg. Whenever we roll the ankle, these nerves get stretched and often get injured. And even with the best rehabilitation programs, I find that a lot of people still come in months, days, weeks, years later and still have some nervous system injury to these nerves, whereby we can feel that the muscular power coming from those everters from the fibularis group is still not there. So if we test them, they often test very weak, and we see this in the literature where there's proven deficits in proprioception, which is the ability to know where the foot is in space, and deficits in sensation and deficits in strength. And that's why with lateral ankle sprains, the rehab process can be very arduous and can take a long time to get the ankle back up to snuff. And those that injure their ankle often do so again. And I feel that acupuncture is an integral component to any rehab program for lateral ankle sprains by using the acupuncture to talk to the nervous system so that we can get the nervous system firing and functioning properly again, so that the nerves are doing their job, talking to the muscles, so that when you're doing those exercises as part of your rehab program, you're doing them effectively and the muscles are getting the work and the attention that they need. So what we're going to do is we're going to go through a little treatment and show you some of the deficits that we see in one of my patients even a year later, and what we can do for this condition. Okay, hi everyone, we got Tara here, and we're going to talk about some of the issues that come with lateral ankle sprains and actually do a demonstration of a treatment we can do to add to part of your rehab program to actually make sure that the rehab that you're doing with your ankle sprain is as effective as it can be and reduce some of the pain as well. So when one sprains the outside of their ankle and often injures that ATFL, the anterior talofibular ligament, with that comes some stretch of the nervous system tissues on the outside of the leg. So your superficial fibular nerve that comes down to provide sensation to the skin over the outside of the leg, as well as providing some muscle innervation or some muscle control along with the deep fibular nerve to the muscles of the fibularis group, which evert the foot and turn it outward, as well as providing some sensation to the front of the foot. These guys get stretched when that foot comes like this as part of the inversion sprain, and with being stretched they get a little bit injured, they don't function as well, and unless, in my opinion, you do some acupuncture to get them functioning properly again, they never are quite restored even with the best rehab program. And what I'm going to do is show you the results of that, not getting it properly rehabbed, and then what we can do with a couple of acupuncture treatments, and the pre and post can be quite dramatic in some cases. So with Tara, what we're going to do is we're going to test her inversion strength on her good leg, her left, and her right leg, her bad, which she sprained about a year ago. So Tara, I'm going to get you to hold that there. Don't let me pull it down. We're just going to test your ability to use those everters, the outside fibularis group. So if I pull as hard as I can barely move that foot down to the ground. But with this other leg that Tara rehabbed well but never had any acupuncture for it, if I try to pull that foot to the ground, I can move it fairly easily. It doesn't have, it's not absolutely dead, but it's got about 70 or 60% of the strength that we want. And with that, we know that some of the proprioception on that side isn't going to be as good. So we'll do some acupuncture and show the pre and post. So here you can see we have Tara hooked up to the electroacupuncture unit, which is providing electrical signal at about 4 Hertz into those superficial and deep fibular nerve points, as well as the fibularis muscle group, which is getting some electricity in to turn on those everter muscles and reset the nervous system in that area. For the most part, it's completely painless. You can see the muscle jumping nicely, which means we're getting a good signal and we're activating the proper points to restore the strength that we want. So we just had Tara on the acupuncture for about 10 or 15 minutes. We did a couple of the points that were shown on the video just on the outside of the leg. I just want to show you guys a pre and post for strength. So generally these benefits, we get them to last for quite a while because you are getting that nervous system turned back on. It's not like if I go back and test in an hour or the next day that we don't have any of the results. Usually there's lots of good residual effects, and it might take a couple of treatments to get it back to perfect. But after those couple of treatments, usually the results stay as long as you do a couple of basic rehab exercises to maintain them. So Tara, I'm going to get you to hold that foot up and don't let me pull it down. So good, nice and strong. And we're going to do this one, and I want you to hold it there and don't let me pull it down. So I can move it a little bit, but for the most part I'm pulling as hard as I can, and there's not nearly that same give that you get with the other side. You don't get any of that wavering of the foot. And Tara, how did it feel to you?
Awesome.
Good and strong. So that's one thing that we do a couple of treatments of, and it really helps. So when you're actually doing your rehab exercises, you know the nerves are turning on properly and properly fueling those muscles, so you're going to have the most effective rehab. Acupuncture can do this and a lot of other great things. If you guys are interested, check out my website or continue to follow along on the YouTube channel. I can show you cool little things that we continue to do in the clinic and get people back to moving how they want to and feeling well.